To my YouTube live video today. If you are just joining us for the very first time, make sure you subscribe to our channel, like our video, and don't forget to share this live video to everyone. Today in this video, we are going to discuss about a crucial something, which is about UTI, that is urinary tract infection. There are a lot of things that happens when somebody have urinary tract infection. In short form, they refer to as UTI. So in this video, we are going to talk about what is UTI, what are the prevention, how does it spread. So don't hesitate to share to others. Drop a question so we can answer your question for you in a live video that you are now. So whatever you feel or what you think about UTI, kindly drop your question under the comment section. We'll give you answer to that. So you're welcome back today into this our sexual and reproductive health talk. I'm so glad to have you all here. Today's topic, as I said, it may sound small, but trust me, it is a big deal that we are talking about today, which is what? Urinary tract infections or UTI. Firstly, let me start with this. If peeing feel like fire, that is, if you are urinating and it feels like fire, that is not normal. That's if it is burning you, it is not normal. So don't wait until the fire actually spreads to one part of your body or to another. So if you notice that there is any burning sensation or you are feeling pain, it's more of fire, pain, you are feeling it down there whenever you are urinating, make sure you report it. Don't wait till the fire spread across all parts of your body. This sounds scary, but don't worry, by the time or we finish this video or by the time we end this video, you understand the reasons why we are talking about that. You understand? So prevent urinary tract infection, any type of infection, you will know how to prevent it by the end of this video. You know how to prevent it, you know how to recognize them early, because there are various different type of urinary tract infection. So by the end of this video, I'm assuring you that you know the different types of infection and how to recognize them when you have a UTI. So, and what to do if it happens. If it happens, if you have to go to hospital, if there's any home remedy, or if there's anything that you can do for yourself to prevent this urinary tract infection. So these are what we are going to talk about today. So imagine waking up in the middle of the night. So you're sleeping and you wake up in the middle of the night with a sharp burning pain every time you try to pee. Imagine that kind of scenario. Or if you witness that, you rush to the bedroom or to the toilet, but only a few drops comes out from your penis or from your vaginal. So imagine that kind of scenario or that kind of experience. You rush to the bedroom and it is only few drops that comes out after you have this serious sharp burning pain. You understand? While you are actually urinating. So this some people even start feeling that the toilet is actually causing them a serious problem. They start fearing to go to toilet. Or have you ever seen somebody telling you that I'm feeling urge to urinate, but I'm scared to urinate? Something like this usually do happens. Why does it happens? And how does it happens? And what to do when it happens? When you wake up in the middle of the night, you start feeling this burning sensation, and at the end of the day you go to toilet, then you'll be scared of urinating because of this infection, because you feel when you start urinating it's have a burning pain, a burning sensation that you usually experience. Or aside this burning sensation, usually feels like it is only little drop of urine out of your vagina or that comes out of your penis. Whenever you feel like this, don't stop there. It is not a problem, because if at all how it is not a problem is only if you report immediately to your medical provider. So because if at all you wait and it spread to other parts of your body, it spread to your kidney, you could end up having different kind of symptoms. You could end up having fever, you could end up having chills, you start having back pain and body pains. These are signs that you start developing, if at all you start having this burning sensation, or every time you try to urinate, you only urinate just little urine, you only have a little drop of urine out of your vagina. You start having fever, you start having chills, you start having back pain, waist pain, all of that. Something that started as just burning urine can turn into hospital admission. That's one thing that we don't usually know about. You think it is just a burning sensation you are having, or it is just a pain or normal pain you have, you start having feeling. But it is a serious infection that it can affect your kidney, and at the end of the day, it lands you into hospital for admission. So, what is really happening in the body when we talk about UTI? When you hear UTI, what is really happening to the body? What is UTI? How does UTI comes about? Or what is the origin of UTI? So that is what we are going to walk through today. UTI happens when bacteria, it is usually a bacterial infection. What type of bacteria? It is usually Escherichia coli, the one we call E. coli. They are the one that is actually responsible for this many of these urinary tract infection. Do you understand that? So when UTI happens, it is when bacteria, usually E. coli, sneak into the urinary tract. In the whole system, we have the urinary tract. The part of the body that actually that is the part of the body. So what really happens in the body when we talk about UTI? That is when somebody have UTI. What happened in the system? UTI happens when bacteria, usually E. coli, sneak into the urinary tract. What is the urinary tract? The urinary tract is a group of organs that helps in the production and excretion of waste products, majorly urine from the body. So when E. coli sneak into the urinary tract, it results to a urinary tract infection. Most especially, women are more prone because their urethra is short. You see, women are usually prone to this infection. Most of the time, they do go to hospital. They want to treat infection. What are you treating? You have infection. What infection? Many of them will end up telling you they have toilet infection. Women are more prone to urinary tract infections, majorly because of the shortness of their urethra. You see that women urethra are shorter. I think they're about 4 centimeters in length, while that of the men is about 20 to 30 centimeters in length. That's the length of the urethra. So this urethra is shorter in women, which makes which makes E. coli to get in faster to the urinary tract compared to women are more affected than men. Why? Because of the shortness of their urethra. So this shortness now it makes them prone. They are now at risk of contracting this E. coli. So it is just easier for bacteria to travel because of the shortness of this urethra. But men, you are not exempted. Honestly, men are not exempted. Despite the fact that we have a longer urethra, we are not exempted. We can also come up with these urinary tract infections. Issues like an enlarged prostate can result to urinary tract infection, poor hygiene. The man that doesn't take good care of himself, he has a poor personal hygiene, he doesn't take care of himself properly, you can come up with that. Or even unprotected sex can set up into trouble. Men that do engage in random sex with multiple sexual partners, you can come up with urinary tract infections if care is not taken because of the multiple sexual partners you have. Some of them might have this urinary tract infection, of which it can be passed among themselves. So whenever you come across a partner with urinary tract infection and you had a sexual and unprotected sexual intercourse with them, you can come up with this urinary tract infection. So the common symptoms that one usually feels when you have this urinary tract infection include burning sensation when you pee or when you urinate. Each time you try to urinate, you are having this burning sensation, tingling sensation around your urethra, at the tip of your urethra. You're having this pain as if it's burning you, something is tingling you over there. So that is one. Then two, you also come up with a cloudy or smelly urine. Each time you urinate, it's as if it's cloudy. It's as if you have it's foamy. Hmm? That's another sign and that's symptoms. of urinary tract infection. Each time you urinate, you check the toilet, it looks foamy and is smelling. Have you noticed that? If you have noticed anytime you urinate that it's smelling too much more than the normal how you normally urinate to smell like an aromatic smell, that could be a sign of urinary tract infection. So if you also have or experience this foamy urine, cloudy urine, or smelling urine, that is the symptoms of UTI. Then seeing blood in urine, it's also part of it. Each time you urinate, you come up with blood. You see like a drop of blood or stain of blood with your urine. That is a danger sign of urinary tract diseases or urinary tract infection. You understand? So most of those things they are usually contracted through poor hygiene, unprotected sexual intercourse, and many other things. But the major bacteria that causes it is what Escherichia coli, which is referred to as E. coli. When E. coli get across and come in contact with the urinary tract, it set up an infection and start having these symptoms. Start having fever, start having burning sensation, start having tingling sensation. When each time you urinate, you start having each time you urinate, you start seeing blood, see stain of blood or drop of blood in your. You feel like you need to pee all the time, but little or nothing comes out. So each time you go to toilet, you feel like you want to empty all your bladder, but at the end of the day, nothing comes out. You feel empty all along. That could be a sign. That's because most of the time, when people have this UTI, they are always filled up. Their bladder is always filled up with urine, but they are always scared to go to the toilet because they know when they get to the toilet, it becomes a problem for them to urinate. That is a sign of urinary tract infection, UTI. So another severe sign that we can also have is in severe cases we can come up with fever. That's if the infection is already systematic. You come up with fever, you come up with chills, you come up with back pain. All of these signs they are danger signs of urinary tract infection. So what is your body saying? What is your body saying if you have these symptoms? These are warning signs. These are danger signs that should never be ignored. Whenever you come up with these symptoms that we've highlighted, come up with back pain, chills, fever, all of this, then with those urine, blood drop in urine, with this burning sensation, tingling sensation in urine, these are warning signs that should never be ignored. You understand? These are the warning signs that you should never ignore when you have urinary tract infection. Now, here is why this small jam is a big problem. That is the infection. Why is a big problem is if left untreated, that infection can climb up into your kidneys. If you see the urinary tract is divided into two. You have the lower urinary tract and the upper urinary tract. The lower urinary tract begins from the base of your bladder down to your urethra and outside your penis or outside your vulva. And your upper urinary tract starts with your ureters and your kidney. You understand? So whenever you infection setting from the lower, it can ascend up to the upper part of your kidney and affect your kidneys, and your kidneys become damaged because of this infection caused by Escherichia coli, which causes urinary tract infection. So because of this, for pregnant women, it is even riskier if you have this urinary tract infection. And once it reaches there, that is, once this urinary tract infection leaves from your urethra and it gets to your kidney, it can cause permanent damage to your kidney. So once these Escherichia coli that usually cause UTI, once they migrate from the lower urinary tract and they get to the upper urinary tract to your kidney and they damage it, it can permanently damage your kidney. And if you are pregnant as a woman, it is even riskier for you. If you are pregnant as a woman with UTI, with damaged kidney, it is so it is very, very dangerous for you as a pregnant woman. Yes, because once you have a urinary tract infection, so So if you're pregnant as a woman, or if you're as a woman, if you are pregnant and you have this urinary tract infection without treating it can affect your kidney and your kidneys will be damaged. And if your kidneys are damaged, it will result to a lot of problem for you because your kidney damage can actually result to a problem in your labor. You can have preterm labor. Yes, because you see all this hypertension in pregnancy. That is how it comes up with because of kidney issues that occurs during pregnancy due to urinary tract infection that was left untreated. So it is very, very important to pay attention to this warning sign, to these danger signs of UTI, such as fever, chills, back pain, lower abdominal pain, and more of those symptoms that you do have. The ones you see in your urine, whether your urine is smelling, or your urine is cloudy, or your urine is foamy, or you actually notice blood in your urine. So these are signs that should never be ignored, that they should always make sure you put into consideration and you are always conversant. Whenever you see them, report them to your medical provider because all these signs are warning signs. All these signs are danger signs of urinary tract infection. And when you as a woman come up with this urinary tract infection, whether you are pregnant or you are not, because you are always more prone to UTI. Women are always more prone to urinary tract infection than men because of the shortness of their urethra. So when you come up with that, it is very, very important that you should one, stay hydrated. Always stay hydrated. What do I mean by that? You should always make sure that you take enough water. You should always be taking enough water because water will help you to actually flush your system. How we say? Because you see that some patient will come to hospital, they'll be like, I want to flush my system. Doctor, I want to flush your system. No, it's not like that. The best thing that can actually help you to flush your system is by taking enough water. Take at 5 liters of water every day. When you take this water, it doesn't just improve circulation of blood around your body, it also helps to remove whatever toxins that are present in your kidney, in your urethra, in your bladder, in all your urinary tract. All those toxins that are present there, with the help of hydration, with the help of taking a lot of water, it helps to remove those toxins from there. So, and at the end of the day, it will reduce you from risk of coming in contact with these urinary tract infections. So always make sure you stay hydrated as a woman. It is very, very important. Aside the overall function or overall benefit of taking water or drinking water timely, it also helps a crucial way in battling with urinary tract infection. That is number one. Then number two aspect of urinary tract infection that you have to also make sure you take into consideration is you as a woman, each time you have sex, sexual intercourse, or whenever you have sex with your partner, when you finish having sex with your partner, always try and make sure that you urinate. Try and urinate, empty your bladder. You don't just finish having sexual intercourse and you cover up and close up like that. You have to make sure you urinate and do a proper hygiene. Urination will help to remove whatever semen or fluids or that could remain after sexual intercourse or after coitus. So it will help to like flush them out, whatever remains that are there. So try and make sure you urinate immediately after sex. So doing this will also help you to prevent urinary tract infection from ascending from the lower part of your urinary tract to your kidney, which can actually result to damage in your kidney. So let's try to make sure you urinate after sex. It is very, very important. That is two. Then number three thing is always make sure you maintain hygiene immediately after sex, immediately after you urinate, or immediately you use the toilet. Always make sure you practice hygiene. How do you do this? To make sure you have enough water with you. Wash whatever you want to wash. Then whenever you are washing, try and wash from the back to the front. Try and wash from the back to the front. You don't wash when you wash correctly because at the end of the day, after you use toilet, maybe you try to use toilet or you urinate, or after sex you don't clean yourself up, you are actually storing those things there, and they eventually end up causing you more harm, causing causing those infection, and those infection will actually ascend to your upper tract, to your upper urinary tract, and cause you a lot of infection, cause you kidney diseases. So let's make sure when you have sexual intercourse, try and make sure you wash yourself properly, you clean yourself properly. It is very, very important to practice personal hygiene immediately or during and after sexual intercourse. It will also help you. Then the number four thing that you should always make sure you do to help you with your urinary tract is intake of probiotics. When you increase more on your probiotics, it actually helps to fight against all those bacteria that will wants to come and colonize your urinary tract. All these Escherichia you see, probiotics will help you in your fertility, will helps to actually fight against this it also help to fight against this Escherichia coli that can help or that can cause this urinary tract infection. So increasing your probiotics is also very, very important as a woman, even as a man, to increase them, take your gut and those chews. It will help you to treat or to fight against those um, urinary tract infection. So always make sure you follow these precautions and preventions and what to do when you have this. I've told you the warning sign. The warning sign is whenever you start having burning sensation, tingling sensation, or you start seeing blood in your urine. These are warning signs. These are danger signs. Back pains and all of that. These are all danger signs of urinary tract infection. Whenever you see or you start seeing this sign, kindly report to your facility or to your medical provider, because that is a warning sign that your kidney might fail very soon if not treated, or if immediate medical attention, are not seek immediately. So always make sure you seek immediate medical attention whenever you have burning sensation when you are urinating, or you go to toilet, you want to go and pee, you only have small drop of urine coming out, you are not comfortable, or you go to toilet, you are scared of urinating, your bladder is full, or you are scared of urinating. That is a problem. That is a problem. So if you are watching us anywhere you are watching us from, kindly comment your question. If you are anywhere you are watching us from, interact with us. Let us know where you are watching us live from. Let me know. Say hi and say hi to me. Let's begin conversation. We are still on urinary tract infection, and we are talking about what are the danger signs that you should never ignore. So tell me what you've heard about infection, toilet infection, or anything that you think you need to discuss about. This is a live video of which whatever you publish here, we'll discuss it one-on-one, and nothing is saved. So talk to me, let us have a discussion. What do you think we should also add, or we should also discuss in our next live video? What do you feel? What's your suggestion that you think we should also discuss more aside this urinary tract infection we are talking about now? What is that topic you are not cleared with? So talk to us, let us know what you have for us. So always make sure you take enough water. Please take a glass of water every now and then. It is very, very important for you. As a woman, as a man, it is very important. You are always hydrated. Make sure you take water. It prevents those toxins that can cause infection. Signify where you are watching us live from, and we'll communicate, we'll talk, and make this live interactive. It's supposed to be an interactive session where you tell us what to discuss, but we just feel okay, let us discuss about urinary tract infection. So if there's any other thing you want us to discuss about your health, your reproductive health or sexual health, about men, fertility, or your menstruation, you can bring it up, write them in your comment section, and tell us where you are watching us live from, and we'll discuss more of that. So we'll discuss more of that. We are talking about urinary tract infection, where I tell you the danger signs that you should never ignore when it comes to urinary tract infections or urinary tract diseases, such as burning sensation, tingling sensation, or you have fever, chills, or you have rashes, you're having itching as a woman, you're having itching in your vagina. These are danger signs that you should never ignore. These are danger signs you should never ignore. So tell us, what do you think it can cause infection? Is there anything like toilet infection? that you think that okay, you're always coming up with toilet infection. With anything like that, of course, there is nothing like toilet infection. You have a urinary tract infection, which is majorly caused by E. coli. E. coli are the one that usually cause this urinary tract infection. So, where are you watching us live from? Have you heard of toilet infection? Then, what do people talk about toilet infection? Is it true, or what do you think it causes toilet infection? Because there are some people that they're always scared of urinating. People that are always scared of urinating going to toilet. They have the urge to urinate, filled up, but when they get to toilet, it's become a problem for them. So tell us in the comment section. Let us interact. If you are watching us live, I can see you. So just comment where you're watching us live from. Let's interact. Let us know ourselves. Have a community where we discuss. Let us interact and let's know ourselves. Just say hi to me. I'll be very glad. You don't just watch and pass. Say hi, let us discuss more of those things that we need to add to our live video. When next should we come on live video so we can interact? I can join you to my live video if you wish. So just comment and tell us where you're watching us live from. So as I was saying, if you actually want to prevent urinary tract infection, uh, water is very, very important. It's very, very important. So take enough water, take at least 5 liters of water every now and then. Early in the morning, make sure you take a lot of water before you urinate. It will help your whole system. You can see water is very, very crucial, like I said. It is very, very important for your whole system, for your viral system. It builds up your muscles. It helps in blood circulation. It helps the intra. It helps in it helps to provide fluids to major organs in your body, which prevents friction and mechanical injuries. So tell us more about what you think is toilet infection. Is there anything like toilet infection? Of course not. So where are you watching us live from? Give us suggestion, write your comments, let us interact. I can add you to the live video. We actually talk. Let us know, are you from Nigeria or South Africa? Because I have some of my viewers from South Africa. I have from the United Kingdoms. So if you are there, let us interact. Let us have an interaction. Let us discuss more. Just say hi. Don't be shy. This is a live video of which after this it is not published anyway. So we just have this discussion so far and so forth. So aside taking enough water, you can also make sure you urinate. The importance of urination after sexual intercourse. I told you this is very, 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 very important. Make sure you urinate immediately after sex. Because if you don't urinate after sex, and after sex you just jump up and wear up your panties and anything, it can cause a lot of damage. It can cause a lot of infection, urinary tract infection in your system. So it is very, very important that you always urinate after sex. So comment from where you watching us live from. Tell us what we need to discuss, what question you want to ask. Is there anything that you want us to discuss more in our next video? Tell us, is there anything you want us to discuss in our next live video? So let us have an interaction. I just want to ask us to have an interaction. Just comment hi or tell us where you are watching us live from. That is all. Hi, ask your question regarding our channel, regarding anything, regarding your health, for somebody, anything. Just ask us. Let us vibe. Let us talk about your health, your sexual health, about your baby, about your pregnancy journey, fertility, ovulation, many of it. We are ready to answer your question. We are ready to answer your question. Tell us where you are watching us live from. Tell us where you're watching us live from Nigeria, from Canada, from South Africa. I used to have many of my followers from South Africa. from Ghana, from Uganda, from United Kingdom, from United States. So where you're watching us live from, Cardi out there is what watching, right? So tell us in the comment section where you're watching us live from. I am waiting for your questions. Tell us where you are watching us live from. What's your suggestion for our next video? What next should we discuss about? What next should we discuss about in our next video? So tell us more about our channel, about your question, your reproductive health, your sexual health, anything. Just let us know. Yeah, where are you watching us live from? If you are just joining us this video, where are you watching us live from? Let us interact. Share, give me your comment, say hi from here. Let us interact. Share your question. Let us answer a question in the comment section. Try and send your question to us. Where you're watching us live from. I'm ready to take in your questions anywhere you're watching us live from. So we're waiting to take your question. Where you're watching us live from, just comment hi and tell us where you're watching us live from. What should we discuss about in our next live video? Today we've talked about urinary tract infection. What are the things that are needed to be prevented, or what are the things that can help you to treat that infection? It's not called toilet infection. Like I said, there's nothing like toilet infection. You have a urinary tract infection. And every urinary tract infection has its own cause. So what is the cause of that urinary tract infection you are having? What causes it, and how to prevent it? Tell us in the comment section where you're watching us live from, and let us have a discussion. Any question you have, let us discuss on our previous videos. And what video do you want us to talk about in our next live, or how and when should we schedule our next live video? Coming alive every So I'll be taking your question. Tell us where you're watching us live from. Let us discuss. Let us discuss what is going on. So tell us what you think we should include in our next live video, or what video are you finding or you're talking about? You want us to tell you about your health, your reproductive health, your sexual health, about fertility, pregnancy, or anything, menstruation. Are you missing your menstruation? Have you seen your menstruation? How to calculate your ovulation or anything? We all have that in our channel. Try and go that and watch that. You'll gain a lot of that from there. So we'll be taking your question now. We'll be taking your question. Tell us where you are watching us live from. Live from Nigeria, from South Africa, from UK, from Ghana. Yes, I do have some of you from Ghana. So they do ask their question in my live session. So ask your own question. Don't be left out. This is a live video. We're speaking directly. Just comment hi and tell us where you're watching us live from. I'll be waiting to take your questions. In the next 2 minutes, we'll be going off. So we'll be going off in the next 2 minutes. Send your question. Tell us where you're watching us live from. We're almost coming to the end of our video session. Tell us hi and where you're watching us live from. Let us interact. Let us communicate. Let us talk more about your reproductive health, your sexual health. Tell us more about yourself. So we're going off in the next a minute. That's in the next 2 minutes. We'll be ending off this live session. Tell us where you're watching us live from. Your next suggestion and our next video. When should we come live again? When should we discuss more? And what topic do you want us to talk more about your reproductive health, your sexual health, menstruation, anything, fertility or family planning or anything? Which one do you want to learn? Have many of them in our channel. Go to our channel, kindly subscribe to our channel. Kindly subscribe subscribe for more videos like this. You're going to see many of our videos. Go to our channel and you'll enjoy many of that. Don't forget to hit the like button, like this video, comment where you are watching us live from, and comment your question under the comment section. So we'll see again in our next live video. We're going to schedule the next live video probably in 2 days. We'll talk more on that, and do well to have a restful day and a good day to you all.